an enzyme that metabolizes serotonin and norepinephrine, while monoamine oxidase B, or MAOB, metabolizes dopamine. This mouse inhibitor represents MAO inhibitors, and if a patient is on an MAO inhibitor for depression, tyramine can distribute into the general circulation and cause a hypertensive crisis from all of this excess norepinephrine and epinephrine, while phentolamine can be given to block the alpha-mediated vasoconstriction. Now let's look at the second opera house manager, equally guilty in the eyes of the Phantom. And if you look closely, you'll see that he's not really screaming because of the horrific figure of the Phantom. He's actually screaming because of a horrifying brain freeze. See his delectable rainbow sherbet dessert? Let the occasional pangs of brain freeze remind you of the intermittent headaches of pheochromocytoma. Plus, in a way, pheochromo just sounds like a delightful, colorful frozen dessert. And in case you don't already know, pheochromocytoma is a tumor of the adrenal medulla that secretes catecholamines, especially norepinephrine and epinephrine. That's why we've made the top scoops of the dessert look like little adrenal glands. Symptoms of catecholamine excess caused by pheochromocytoma include intermittent headaches, hypertension, palpitations, and sweating, and this tumor can be seen on imaging. The irreversible alpha-blocking agent phenoxybenzamine, again remember the irreversible phoenix tattoo, is given days in advance to normalize blood pressure before surgery, but the shorter-acting and reversible phentolamine can be used intraoperatively in case of hypertensive crisis during surgery. All right, now it's time to move down to the stage where we'll find out what's in store for our opera singers. Well, if it isn't the lead soprano Carlotta, who's reviled by the Phantom, and she's shrieking in horror as she's trying to free herself from some sort of gothic torture device. Well, this tilt table should remind you of orthostatics. A common side effect of alpha receptor antagonism is orthostatic hypotension. This is because they block the alpha-1 mediated contraction of veins that's important for maintaining blood pressure in the upright position. All this dilation and hypotension leads to reflex tachycardia. This will be represented by this opera house doctor who rushes to her side and, looks like he didn't cover this in med school. What year is this anyways? 1870? Not much he can do with his bloodletting tools, so as a last resort, he falls back on what any of us would have done in times like this, a thorough and focused neuro exam. Notice that the reflex hammer is heart-shaped to represent reflex tachycardia that accompanies this orthostatic hypotension. All right, let's move on to the other opera singers who will represent the alpha-1 selective antagonists, and those are prazosin, terazosin, doxazosin, and tamsulosin. Notice that these drugs all end with O-sin, which are the first letters in opera and singer. So the O from opera and the S-I-N from singer. And notice that we've included a single extinguished alpha candle, our recurring symbol for alpha-1 antagonism. The opera singer here is hitting a pretty impressive A major, 2 octaves above middle C, a little out of his register. But this melodic scream at the sight of the Phantom is intensified by the sharp pain caused by this banister hitting him right in the prostate. Alpha-1 antagonists reduce smooth muscle contraction in the urethra and enlarge prostate, thereby relieving the urinary retention associated with benign prostatic hyperplasia. These agents, however, do not change the volume of the prostate. That's the job of agents that modify testosterone effects. See these loose, dilated sleeves? It's smooth muscle relaxation that you need to remember here. And since these agents inhibit constriction of vascular smooth muscles systemically, they're especially useful for patients with both hypertension and BPH. Looks like the loud crash of the chandelier is giving this O-sin opera singer flashbacks to his days in the Franco-Prussian War. And as he clutches his dog tags, he's praying for safety. The praying opera singer represents prazosin. And notice that the dog tags are labeled PTSD to remind you that prazosin has the additional use of treating some symptoms of post-traumatic stress disorder, such as nightmares and sleep disturbance. The classic side effect of these alpha-1 blockers is first-dose hypotension, involving an increased risk of orthostatic hypotension shortly after initiation of treatment. So remember this orthostatic tilt table up on the opera stage as a major side effect of these alpha-1 blockers. There's just one more alpha antagonist I want to mention before we bring this production to a close, and that's mirtazapine, an atypical antidepressant. The pharmacology of mirtazapine is pretty complex, involving antagonism of presynaptic alpha-2 receptors, symbolized by the extinguished double alpha candles, enhancing the release of both norepinephrine and serotonin. The name of the opera house, Mirth and Misery, should evoke the name mirtazapine, and the smiling mask should remind you of some of the happy serotonin effects that are involved, while the frowning mask should remind you that it's the treatment for depression. Alright, let's sum up the sketch. Under the stage, we have our alpha-2 agonists, which act centrally on alpha-2 receptors, reducing sympathetic outflow from the brainstem. Clonidine, represented by the claw-wielding Raoul, can be used to treat hypertensive urgency, ADHD, and Tourette's. Remember our motor tic-ridden marionette. The alpha-methyl-dopa rope, while terrifying, represents the treatment of hypertension during pregnancy. The surprisingly comfortable chair, lit up by alpha-2 candles in the back, represents the muscle relaxant tizanidine, for 2-Christine. Up above the stage, the phantom of the alpha extinguishes alpha-1 and alpha-2 receptors, representing the non-selective alpha antagonist phentolamine. This phentolamine phantom vanishes as soon as he appears, meaning that he's short-acting, whereas his permanent phoenix tattoo represents the irreversible alpha-1 and alpha-2 blocker phenoxybenzamine. These agents can be useful when treating states of catecholamine excess, including cocaine intoxication, tyramine-induced hypertensive crisis, and pheochromocytoma. All this vasodilation can cause orthostatic hypotension and reflex tachycardia. Our OSIN opera singers depict the selective alpha-1 antagonists useful for treating BPH and concomitant hypertension. The praying prazosin singer has additional benefit for patients with PTSD. And last but not least, mirtazapine, an atypical antidepressant and alpha-2 antagonist that can help turn your misery into mirth. But remember, when you down that delicious double scoop of pheochromocytoma, that's not brain freeze, my friend.
The phantom of the alpha is there, inside your mind.